Moving on to health care. Is Congress doing enough to cut health care costs? Joining us now from Washington, D.C. is Ken Thorpe, Partnership to Fight Chronic Disease Executive Director and former Assistant Secretary for Health Policy at Health and Human Services. Ken, great to see you as always. There is something in the health care overhaul bills that are moving through Congress, both the House and the Senate, that would allow employers to increase the difference in premiums they charge workers to meet certain health standards, meaning would it allow employers to give employees better incentives to be healthy and reduce health care costs?
Well, it does. I mean, even today, employers can change the premiums they charge workers by about 20% if they participate in workplace wellness programs. They can also provide positive incentives by giving them cash value, cash dollars, reduce copays and deductibles in their health insurance benefits. So even in today's world, there's a lot of flexibility to get employees to participate in programs that are actually going to do a good job of preventing disease and keeping workers healthy.
But are lawmakers also focusing on maybe giving employers more leeway on incentives for employees in some of these health care overhauls? And is that something that's maybe being overlooked, Ken?
Well, I think a lot of the cost containment components of the bill are being overlooked. I mean, let's face it, if we're going to slow the growth in health care spending, we've got to target the two key issues. A third of the growth in spending is due to the doubling of obesity in this country, and 75% of what we spend in health care is linked to chronically ill patients. And we really need effective interventions on both fronts. What was discussed as part of the Senate legislation was to give employers more flexibility to provide not just a 20% premium variation, but up to 50% perhaps, in some cases, to incent workers to participate in workplace wellness programs. And, you know, some people think that's too much, and some people think that's perhaps too little.
Why aren't companies doing more nowadays? Some companies are working really hard to give employees reason, not just in the sense of, okay, we'll give you a benefit if you stop smoking, but really the end result of their behavior. Vallejo, for example, you have high deductibles which come down based on changes in behavior and outcomes. Why are companies doing more rather than everybody sitting around and waiting for Washington to come up with a solution?
Well, that's a terrific point. You know, business today can take control of a lot of their healthcare spending by putting into place workplace wellness programs that are effective, doing health risk assessments, doing care plans, working with their employees at the work site to make sure that they're managing their diabetes and high blood pressure. All of those are things that employers can put into place today. They don't need to wait for Washington to resolve this healthcare reform debate, that's for sure.
It sounds like, Ken, though, do we ever get anything out of Washington that truly cuts health care costs? Because anytime anything is floated, whether it's to reduce consumption, whether it's to cut payments to doctors and Medicare, there is something for at least mixed to hate in everything that's been proposed. Do you think we get anything that really brings down costs?
Well, there's certainly elements of cost containment in the bill. I think it's like a lot of what's in this bill. It's better than doing nothing, but it's not everything you want to do. I think if we are really going to do the best we could, we'd find more effective ways of preventing disease in the first place, whether it's in the schools, communities, and in the workplace, and there are good programs that do that. And we've got to find a way to work with where the money is, which is people with multiple chronic health care conditions, to keep them healthy, keep them out of the hospital, keep them from being readmitted to the hospital. Those sort of delivery system reforms that were talked about early on in the process, elements are in the bill, but not anywhere near as robust as we need to do. So we could certainly do a lot more in this legislation to bring down health care costs.
Ken, good to see you. Thank you for being here.
Oh, it's
Ken
good to be
Thorpe,
back. Well, thanks.
Executive Director of the Partnership to Fight Chronic Disease and former Assistant Secretary for Health Policy, the Department of Health and Human Services. Take care.